Trump and Republicans have hailed the passage of the Big Beautiful Bill as a major accomplishment that will benefit all Americans. They have especially tried to emphasize that it will benefit regular working-class Americans. The reality is somewhat different. To understand this, we have to look at the overall impact of the bill, as well as the broader context of the bill and its place in American history. One of the main characteristics of the Big Beautiful Bill is that most of its benefits go to the wealthiest people. At each increasing level of income, the percent tax reduction received increases. Those at the highest income levels have the greatest tax reduction, while those at the lowest levels have the smallest. For the top 20%, the tax reduction for 2030 is estimated to be around 2.2%, while for the bottom 40%, it's only around 0.9%. On top of this, taking into account other changes, such as the cuts to Medicaid, people with lower incomes will actually lose a significant amount of their income. While the top 10% of income earners will gain about $12,000 a year from the overall effects of the bill, the bottom 10% will lose about $1,500. As a percentage of income, the bottom 50% will lose about 1%, while the top 50% will gain about 1.4%. Overall, the top 10% of income earners are set to receive about 80% of the benefits of the bill. While Republicans have tried to emphasize the elimination of taxes on tips and overtime and how these measures will benefit working-class people, these provisions are actually only set to last for a few years. They were written in the bill to expire in 2028. Other tax cuts that primarily benefit the wealthy, however, last longer. The expansion of the SALT deduction, which benefits wealthy individuals in states with high taxes, such as New York and California, is set to last for 5 years. Other provisions, such as raising the estate tax exemption to $15 million, were made permanent. To understand the broader context of these changes, we have to look at how the income and wealth distribution in the U.S. has changed over the past several decades. Since the 1970s, there's been a major shift in the distribution of economic resources. Those at the top have taken a larger and larger share of income, while those at the bottom have had their share significantly reduced. Even those in the top half, but below the top 10%, have had their share of income reduced. The shift in wealth towards the top is even more extreme. The top 0.1% have increased their share of wealth from less than 10% in the 1970s to over 20%. Meanwhile, the wealth share of the bottom 99% has declined from 77 to 65%. This bill will massively accelerate this already strong trend of wealth being increasingly concentrated at the top. Meanwhile, the poorest Americans, and even the middle class, will continue to be paid less than in previous decades, will continue to have difficulty buying their own homes and struggling with affordability, and will continue to struggle to pay for health care, which will now be even more of a challenge because of the bill. The bill's most devastating impacts will likely be around healthcare. As many as 10 to 15 million people are set to lose their health insurance. Currently, there are around 25 million uninsured people in the U.S. From this uninsured population, around 20,000 people die every year because they don't have insurance. An increase of 15 million more uninsured people would translate to around 10,000 additional deaths each year. It's well understood that whether people are insured or not has a significant impact on their health and their likelihood of dying. The idea that Republicans have put forward for these cuts is that they are reasonable because they have only established work requirements, and they are necessary in order to cut government spending and prevent a debt crisis. The bill, however, overall greatly increases the deficit, making the debt problem even worse. This is primarily because of the heavy tax cuts granted to those at the top. At the same time, the reality of the changes and additional requirements that have been created is that they will hurt many people, including those who meet all of the new requirements. The new work requirement only accounts for around 30% of the bill's total cuts to Medicaid. There are also cuts from reductions in how much healthcare providers are paid, as well as restrictions on one of the main sources that states use to fund Medicaid. These changes will make it harder for states to fund Medicaid, and some may be forced to make further cuts to Medicaid or raise taxes. They will also put hospitals and other healthcare providers in a worse position, as they will lose a significant portion of their income. Rural hospitals are especially reliant on Medicaid funding, and these cuts will hit them especially hard. The bill also creates more barriers and obstacles for people enrolling in and renewing their Medicaid coverage. The rules for eligibility and reapplying have been made more complex, and more paperwork requirements have been created. States are now required to recheck eligibility every 6 months instead of yearly, which will make it even harder for people to keep up with their enrollment. The added work requirement will serve as an additional obstacle, even for people who meet the requirement, as it will be an additional level of paperwork and bureaucracy that they have to deal with. The administration will also have much more paperwork to process, which will create even more problems and delays. Putting all of these additional requirements and this extra heavy layer of bureaucracy in between millions of people and their healthcare will inevitably lead to many people losing their coverage, even those who meet all of the requirements. On top of this, the reality of cutting off millions of people from their health insurance is that it will not actually save money. All people need healthcare. When people don't have insurance, they go longer without getting any treatment, and their health problems become worse until they get to the point that it is an emergency and they are forced to go to the hospital. This emergency care is much more expensive. Treating health problems early is far more effective, and it's cheaper. If millions of people have their health coverage taken away from them, this will lead to less use of preventative care and much more use of emergency care. People will have much worse health outcomes, many more people will die, and all of this will be much more expensive. The costs of this will be passed on to every American. Hospitals will be left with higher expenses and will be forced to charge more. Insurance companies will then have to raise their premiums even higher than they already are. The US already has a huge problem with this. There are 25 million uninsured people, which is a big part of why the US spends around twice as much per person on healthcare compared to other similar countries, and yet has practically nothing to show for it. While Republicans have tried to claim that the big beautiful bill will be beneficial for regular working-class Americans, it's clear that most of its benefits will go to the wealthiest people. Its main long-term effects will be to further expand the level of wealth inequality in the US, and to make our already struggling healthcare system even worse.